Well, that's a great question. So there is a whole field of emergency PT that doesn't just include emergency departments. So there are PTs that are involved in disaster relief. There are PTs that are involved in the National Park Service, in wilderness medicine. A friend of mine works for the Department of Homeland Security doing disaster planning as a physical therapist. So that's always, it's such a broad field. And then I think of our sports PT colleagues who are doing sideline coverage. Those are also emergency PTs. Our physical therapists in the military are combat PTs. Those PTs are also providing those emergency PT services. So I think what they do is very different from what we do. They're very much first responders, whereas PTs in the ED are more of that first receiver. But I also think that we need to expand this model to urgent care. So I would love to see a physical therapist in every ED in urgent care, or at least have one be accessible by telehealth, because there's so much we can contribute. And I think there is a lot of support for this model, like in the workers' comp area, where people go to an urgent care for a workers' comp issue and often have physical therapists present. But really, again, much of what goes to urgent cares are physical therapy type patients. So I also encourage patient or PTs who run outpatient clinics to provide some sort of digital triage to their patients so they can actually help us keep some of those patients out of the emergency department.